All right. Thank you for joining me for quick takes about Boswellia. My name is Jerry Angelini, and I am the owner of Supplement Science Education. A quick orientation, Supplement Science Education does not endorse any specific product or supplement company, and the webinars do not explicitly or implicitly intend to diagnose, treat, prevent, cure, or mitigate illness or disease. So if you have a medical condition, please consult your qualified healthcare practitioner. Boswellia is the genus name for Boswellia serrata. It's commonly known as frankincense, and it's a small to medium-sized deciduous tree. It's native to dry mountainous regions in India, northern Africa, and the Middle East. The part that's collected is the tree resin, sometimes the bark, and the essential oil. Boswellia has benefits that are focused around immune modulatory activity. So Boswellia supports graceful joint movement and function, supports daily cartilage and bone regenerative activity. And this may take about 4 to 6 weeks to kind of like settle in so you feel that experience, that significant supportive experience. Boswellia supports respiratory function, graceful breathing, and respiratory immune pacification activity. And Boswellia supports intestinal function, stool formation, and intestinal immune pacification activity. It also supports male urinary function and comfort. And then finally, there is some cell and animal data for glycemic balance and cholesterol metabolism. Unfortunately, there's one human clinical trial that showed no impact on either glycemic balance or cholesterol metabolism, so more research is definitely warranted. We want to verify that Boswellia products have been tested by U.S. independent labs for identity and heavy metal presence. Because Boswellia is sourced internationally, it's pretty prudent to find a company that considers factors like ethical and clean cultivation, harvesting and preparation practices. Standardization markers for Boswellia include a number of boswellic acid compounds, and some of these compounds are more or less absorbable than others. So you will also want to consider a product that either has a phytosome, a liposome, or paired with other herbs that have been tested to increase absorption. And this includes things like black pepper, piperine, or even turmeric. You always want to check the suggested serving size and directions for use on the label. You might want to take it with food if you have a sensitive digestive system. Boswellia may have drug interactions with anticoagulants, antiplatelets, medication, NSAIDs, anti-inflammatory, immunosuppressant medications. Although unlikely, you may want to monitor blood sugar levels if you are a type 1 or type 2 diabetes and you're taking medication for it. There have been some reports of mild blood pressure reduction. So all in all, you want to talk to your healthcare provider if you're on medications for any of these health concerns or even others. You can take Boswellia in the morning, in the afternoon, the early evening. You really want to observe your individualized response to any supplement and determine if it's ultimately the right fit for you. All right, thank you so much for joining me on this quick take on Boswellia. If you have any further questions, you can email me at jerry@supplementscienceeducation.com, and I hope you have a great day.